Hello, everyone. Thank you for coming today. My name is Julie. I am a nurse. I've been for quite a while. A little bit about me. I have a lot of experience in what it's called open heart surgery. I even work for what it's called a limb salvage project. It's people that is close to have amputations, and their very last resource is when was our clinic to help them prevent them from losing an extremity. Right now, I work for a primary care provider office. I help them running what is their diabetes program. It's been for over a year now. We have been quite successful in that. And I also help them with general education for our patients. Today, we're going to talk about a topic that I just love, and it is about heart disease. The purpose today is to learn about cardiovascular disease, a little more about the different risk factors that this disease has, what is hypertension, signs and symptoms of the stroke, heart attacks, and then we, of course, going to talk a little more about myths around it. So let's start talking about what is cardiovascular disease. Cardiovascular disease is a disease that affects everything related to, everything related to the circulation of your body, including the heart. As you can see, circulation covers every single part of your body, including the brain. And depending where it is affected, that is how we're going to call it. So coronary heart disease, like the word says it, is the heart. It's about the veins that are in the heart. Cerebrovascular disease related to the brain. What it means is people that have had strokes. Stroke is a vascular accident, part of the vascular disease. We have the peripheral vascular disease, which is every extremity. Feet, legs, hands. Rheumatic heart disease. The rheumatic heart disease is inside the heart, and that happens to people that have had rheumatoid fever, or also strep infections, strep throat infections. The strep throat infection is known because the kind of reaction that causes inside the body for the immune system sometimes can, if it is not treated on time, will end up affecting the valves inside the heart. That is why it's important. Any questions? So yeah.
That still blows my mind that, untreated strep throat can.
Number one reason why
I mean, I know.
People under 40 years old get a valve replacement. Number two reason is IV drug use. So the rheumatic part is just an overreaction of the body that creates some kind of adhesions and malformations inside the valve that makes it not working properly, and that's why it needs to be replaced. We have the congenital heart disease. This is people that is born with different defects inside their heart. They can be, there's an itty bitty hole between the atriums and septums that when a baby is born, the first thing we do is make them cry. That crying is what closes that hole. But sometimes that hole doesn't close and stays open. When that happens, the baby has to be monitored over time to make sure the hole is not getting any bigger or that it closes over time. If it doesn't close,
Thank you.
The blood that has oxygen and the blood that doesn't have oxygen gets mixed up all the time, and the body is not receiving the oxygen needed. Some other defects is just some people, the valves are not well formed, or the walls that divide the different chambers in the heart are not there. So those are different things. Thank goodness now with all the advances in medicine, they have a higher chance to survive, but they have to be closely monitored for that. And then we have the deep vein thrombosis and pulmonary embolism. What this long word means is there is a clot, normally in the legs or any part of this, that it just migrates somewhere in the body. Sometimes it stays right there in the leg, sometimes it goes in to the lungs, and some other times just goes to the brain. And if it stops circulation to a given part of the body, it causes a stroke, it causes a pulmonary embolism emergency, or it causes a heart attack. Okay, so some risk factors for the vascular disease is unhealthy diet, a diet that is saturated in fat, mainly a lot of carbohydrates, gonna cause build up inside of that fat that is floating in the blood, inside the veins and the arteries at different parts of the body. Lack of physical activity. This is because when we move, we promote circulation, especially circulation to the most distal parts of the body. Tobacco. So tobacco, when you smoke, and it doesn't matter if it is chew tobacco or if it is vapes or just conventional cigarettes, doesn't matter what amount of nicotine you have. Just matters that the more nicotine, the worse it's gonna get. As soon as you have that small amount of nicotine inside your body, every single vessel of your body is going to close. So instead of having a big diameter, you're just gonna close, smaller diameter. And what happens in your body? Well, just think about when you have the hose in the garden. What happens when you twist that hose? It's going to be harder to get the water outside. The flow goes lower. That is exactly what happens inside the body. The flow is not adequate. And then that's how we start causing damage inside the body. Alcohol, when the alcohol is clean out of the system, the body converts alcohol into sugars and some byproducts, some waste products. Some of those products are family of formaldehydes. And if you remember, formaldehydes are cancerous substances. So these byproducts are also cancerous substances. Doesn't mean that you're gonna have cancer just because you have one drink. It means that high consumption of alcohol is increasing your risk for some types of cancer. Same as smoking, it increases your risk for some types of cancer. Other secondary risk factors, and this is when you have a symptom or a disease that has not been well regulated, it's going to cause vascular disease or cardiovascular disease. Raised blood glucose. So if we go back to what happens inside the body when your sugars are too high and you don't have enough insulin, the body starts in a fight and flight response. You don't have enough glucose, your whole body needs that glucose to get energy, and the body starts yelling, I need glucose, I need glucose. And the body, inside our body, the whole machinery we have, will try to compensate for that. And one of the ways it does is increasing the heart rate, to increase the blood pressure inside your body, to rush that insulin that hopefully the pancreas will create. But if you have diabetes, it's not going to be created. So it's a cycle that keeps speeding up the blood inside our body just to try to get some of the necessary glucose and insulin that's needed for our body. So high raised blood glucose, it's a secondary risk factor because you are overworking your heart and your body. That's why raised blood lipids is also a risk factor, because when we have high, huge amount of lipids, they're gonna build up somewhere, and they're gonna obstruct some of those vessels, which is gonna increase your heart rate and blood pressure. Overweight. Why? Because with overweight and obesity, Yeah, overweight and obesity, the only difference is how much weight you have. And overweight is even more than just obesity. Actually, the opposite, I'm sorry. Obesity is worse than overweight. Obesity is when we start seeing super morbid obese. And so when we have this, the more fatty tissue our body has, the harder it's gonna be to receive circulation to every single part of our body. To receive, yeah.
I just had a question, where it says raised blood lipids, is that high cholesterol?
Yes, that
Okay.
is high cholesterol.
Okay.
So when you have extra fat in your body, fatty tissue doesn't have good circulation. But fatty tissue will also start creating pressure from the outside of the body to the inside, blocking some of the circulation that goes to the organs. Plus, it's added weight to your body. So if you're laying down, all that pressure is coming to the center part of your body, which reduces circulation even more.
Mhm.
And then, of course, when we were talking about diabetes and how it affects the raised blood glucose. So let's talk about hypertension. When I see hypertension, I like to imagine a house and the pipes inside, all the plumbing inside the house. So the house is our body, and the plumbing is all our vessels, arteries, and venous. So, like when you have a house, what happens when the pipe is blocked somewhere? It bursts.
Big problems.
Yes, big problems and a lot of cleaning. Same with the body. It's going to burst and it's going to cause a lot of cleaning inside your body. So what does it mean? You have a vessel right here, the very first vessel on top. It's a normal vessel, fluid, all the blood can just run through with no obstacles at all. Over time, because we have uncontrolled lipids or other diseases around, that vessel is going to have some build up, in this case it's fat, and it's going to narrow how much of that blood can go through. That can also be deposits of nicotine. And over time, after a very long time, the blood has sediments, the red blood cells are sediments, so they're going to start building up, narrowing even more the flow of the blood. And in this case, it's causing a blood clot. That blood clot, whatever is at the left side of this picture, is receiving proper circulation. Whatever is at the right side of that picture is not receiving any blood. And if you're not receiving blood, you are dying, actively dying. So this blood clot can stay there and become chronic, and you might require surgery to restore circulation, or it might just migrate and go to affect another part of your body. Sometimes the brain, sometimes the heart, sometimes the lungs.
That's so scary.
And it is so common. So now let's talk about the two most critical parts of the vascular disease events that we have. The first one is the stroke. Stroke is when there is a blood clot affecting the brain. It can also happen because that vessel has been very narrow over a lot of tension for a long time, that it just bursts and causes an internal hemorrhage. So the stroke symptoms is important to know and identify them early enough, because the earlier this person can receive treatment, the higher the chances that it's not going to have bad consequences from a stroke. So very common symptom that we have is balance. This person, you will notice that they cannot walk straight. There are two options. They're going to walk like something's pulling them to one side or another one, or they're just going to be very, very lazy. They might try to stand up and just fall. They walk very careful and slow because they know they're gonna fall. Another one is sudden loss of vision in one or both eyes or double vision. Um,
Double vision, really?
it could be both. Double vision because your blood pressure is going too high,
Mm. Mhm.
or that eye just definitely there's something happening inside and that part of your brain is not working anymore.
That's good to know.
The face looks different. Some of the things that we ask them to do when we think that they're having a stroke, we ask them to smile. And we check for the ends of the smile. They have to be equal. Sometimes one side, the affected side, they just can't. It's completely twisted smile. We ask them to raise their eyebrows and the affected side is not even going to move. Or you could just look at their face and you're gonna notice this part of the eye just falling, drooping, and even the mouth just falling down. Like a melted candle. That's how I like to think about it. It's like a melted candle, it's just like drooping.
When you go to the dentist and they like numb your
Exactly.
face, it's like,
Exactly. Just like that. Like when you go to the dentist and you receive some anesthesia, that side of the face is just completely down. That's exactly how it can look. Arm weakness, that's very easy. We ask them to raise their arms and you're gonna notice that it's gonna drop. Or it's gonna be like, this is as high as they can. But because it's affecting the brain, they think arms are equal, so hands. But now you can notice that it goes down. It's completely weak. Speech difficulty. This is depending where it is affected in the brain. They might be thinking at that moment that they're telling you something is going wrong with me, but what you hear is completely slurred. You just don't know what they're saying. Or what they're saying just doesn't make sense. It will be like monkey, dog, banana. And you're like, what are you saying? And in their mind, they're telling you something's wrong with me. Whenever you find someone with any of these symptoms, just please call 911. The fastest we can get this person to a center, stroke center, the higher the chance they're gonna recover from it. Don't try to be a hero, don't try to give any medication, anything. The reason why, another reason why we shouldn't be even giving medications is because number one medication that is given, it's called alterflaze, and if that person had been using aspirin within the last 4 hours, I want to say it's a specific period of time, they cannot be given that medication. And the recovery will be even slower. So don't try to be a hero, don't try to solve anything, just call 911. Now let's talk about the heart attacks. Symptoms for women and men are different. The most common one, let's start with the male ones. They start having lightheadedness, perspiration, they just start sweating like crazy. Very common one is also the stomach pain. They think they are having acid reflux and you see them taking Tums like crazy.
oh no.
Yes, 2, 3, 4 Tums a day because they just feel their stomach, something is weird.
Mhm.
Chest pain and pressure, pain in the jaw, this area of the jaw, and sometimes the pain just goes to their arm, radiates to the arm. It's another very normal in males. When in doubt, call 911. Take them to the ER. We think this person is having a heart attack. In less than an hour, that person should be connected to a monitor and should have their labs drawn. That would be the main 2 things that will let us know if, in fact, this person is having a heart attack or not. Now, women, it's a little more tricky to detect heart attack. That's why women tend to die more from heart attacks than men. The 2 reasons is because the symptoms, women tolerate way better the pain compared to men, and the symptoms are less common, especially the back and neck pain. So having pain in the back, and we think that it's just a muscle that has been pulled wrong.
Mhm.
We have shortness of breath, nausea and vomiting. Like if someone tells me it's having nausea and vomiting, it's more common to think that that person might be having some kind of food poisoning,
Mhm.
GI upset. Is less common associated with a heart attack, anxiety. We as women, we are very normal to have anxiety on different aspects in our life. But anxiety is a well-known one when they are having a heart attack. The back and neck pain and dizziness. So they are like more general symptoms that you will think of or that you will associate like in your normal life. But if you have more than two together and nothing is helping you with them, definitely call 911. Scary. See your face.
Oh, my mom was an ER nurse for a long time, so like it happens. And people think it's like acid reflux or
Yeah,
you know.
it's so common to see them with a bunch of tubs of Pepsi in their pocket, and it's a heart attack.
It's crazy.
So let's talk about some myths around cardiovascular disease. The most common one that I probably hear is that I am too young to worry about heart disease. And that is not true because cholesterol doesn't happen overnight. Cholesterol doesn't happen just because you turn 30. That is your lifestyle. And the younger you are when you decide to take care of yourself, the more you're reducing the risk for all these chronic illnesses. So, fun fact about heart attacks, the younger you are, the less chances of you surviving that heart attack. And the reason for that is because when a person is older and they start having bad circulations, the body adapts so well to be in bad shape that also creates something called collateral circulation, just to create alternate ways to send the blood through the blockages that that person is having over a very long period of time. A younger person doesn't have that. The body probably hasn't even had time to think about creating collateral circulation. That's why when they have a heart attack, there is a higher chance that they could die. I don't know if I had high blood pressure because there will be warning signs. No. High blood pressure is called the silent killer because, again, your body adapts to be in bad shape. And it happens, you're not going to have high blood pressure overnight. It happens gradually. That's why when someone is first diagnosed with high blood pressure, depending on how high it is, we actually have to gradually bring it down again. Because if we do it overnight, that person's going to be passing out. The body has to adapt to be in good shape again. I'll know when I'm having a heart attack because I will have chest pain.
We know that's not true.
I think the previous chart showed us that women and men present very different symptoms when they're having a heart attack. Diabetes won't threaten my heart as long as I take my medication. That is partial truth. If you take your medication, you're taking care of your diabetes and controlling it, you are reducing your risk for vascular disease. But if you just take your medication and you never check your blood sugars and you think you're fine, your chances of increasing the risk is quite high. I don't know, my short period helping diabetes patients, I haven't seen any of them that improves their A1C or their diabetes just by taking medication. There has to be a conscious decision to actually wanting to be better and take action on their diet, and how they're eating, and what they eat. Heart disease runs in my family, so there's nothing I can do to prevent it. I think that there is a lot of genetic predisposition. The same with diabetes. There's a predisposition for you to develop these diseases, but how you manage or how you treat that disease, how serious you want to prevent them, it's even more important. Like my family, I have a lot of diabetes people, and I have a lot of heart disease. I have my grandfather dying from a heart attack. I have my grandmother with really bad diabetes that she decided never to control. I was pre-diabetic, and when I heard the word, I said, I'm not gonna be a mom.
Yes, good for you.
Yes. So I was able to get me out of there. My A1C is now what, like 5.3? Yes,
I love that for you.
thank you. And I said, no, I do not want to be that for me. So I was able to prevent that for me. My cousin is still diabetic, and he is way younger than me. He is like 12 years younger than me. He just decided he was going to be one. So, yes, you can have a genetic factor, but what you do with that information, it's what's gonna, at the end, give you a gain or lose. You can decide to be better than that. I don't need to have my cholesterol checked until I am middle-aged. No. The earlier you know these things, that your risk factors, the better you're gonna have outcomes, because then you have time to work against it. Not waiting until the disease already developed to try to fix it. Heart failure means that the heart stops beating. If your heart stops beating, you're dead. Heart failure means that your heart is failing. Why a person is diagnosed with what causes heart failure? Number one reason for heart failure is uncontrolled hypertension or high blood pressure over a very long period of time. Why? Because the heart is like a balloon that inflates, deflates constantly. And if you do not control that high blood pressure, you're making that heart work even harder. Over time, because the heart is a muscle, it just gives that and becomes enlarged. That is what it's called heart failure, when the heart starts changing shape and function. This pain in my legs must be a sign of aging. I'm sure it has nothing to do with my heart. That is the first sign that you're having peripheral vascular disease. In men, also not being able to pee properly, that can be a sign of hyperplasia of the prostate becomes enlarged, or they're having vascular disease changes. My heart is beating really fast, I must be having a heart attack. Please go and call 911. There are different reasons why your heart could be beating really fast, not necessarily just a heart attack. It could also be atrial fibrillation, which is an issue in the electrical part of the heart, not the mechanical part. A heart attack is the mechanical part failing. It's when part of the heart, normally because it's not receiving enough circulation from a blockage somewhere in the arteries that it has. So that part that is not receiving circulation is dying or is already dead. That's what a heart attack is. Like the last pain that is feeling that part of the heart. I should avoid exercise after having a heart attack. That is another lie, because the number one thing we need to do, or that we have to learn when a person has a heart attack, is they have to recover. They have to rebuild that strength. It doesn't mean that they have to stand up and run a marathon, but it means to start working out to recover. It's called cardiac rehabilitation, where they slowly build them up back to a most normal state. These are really good sources if you want to find more information about this topic. I highly recommend the Heart Organization, the American Heart Organization. They provide all kinds of resources and patient education. Also, the CDC website, Center for Disease Control of the Government, about heart disease and risk factors, and the WHO, World Health Organization. They also have a lot of fact sheets related to cardiovascular disease. Any questions?